Hello, my name is Professor Chaim Tal. I'm a full professor at Tel Aviv University. In addition, I'm doing a private practice. My practice is limited to periodontology and oral implants. I'm going to present a case of a patient, male, 65 years old. He was diagnosed as a post-chronic periodontal disease with a lot of bone loss. The decision was to extract all his front teeth and following ridge preservation, placing 2 implants in order to support an overdenture in the future. Since coral does not present any risk factors to humans and have all the advantages of bone, we decided to use CoreBone, which is made out of cultivated corals. It does not need special sterilization like some of the other animal-derived materials. We do gross scaling before the procedure, then we destabilize the teeth, if needed by elevator and dental forceps. The tooth are extracted and then we clean the socket using special instruments, among which also rotatory instruments, and we prefer sockets that bleed freely. We then do an incision to lift a flap or a mini flap, since we intend to use membranes. Now we have to prepare the CoreBone, the bone substitutes. We carefully open the vials and pour it into a deppen dish or a sterile vessel. We have to wet the material, the dry material, with either sterile saline or patient's blood. Some of us even prefer to mix it with PRF. We wait about 2 minutes and then we remove the excess of fluids, and the material is now ready to be inserted into the sockets. For this purpose, you may use either a suitable injector or a simple spatula. Filling the socket is done by small portions of material. Each one is mildly and delicately dense into the bottom and the sides of the socket until the socket is completely filled to the level of the socket walls. In this case, we decided to cover the aperture of all the filled sockets with resorbable collagen membranes for different reasons. The flap has to be freed from the bone under it by a delicate dissection of the flap from the underlying mucosa, and then immediately we go for the suturing. When you have a single socket, the easiest is to do single cross sutures. However, in our case, we had neighboring sockets, so I decided to do a longitudinal locked suture. In 4 to 6 months, we expect the surgical site to be ready for implant placement.